CEN Test Prep Exam UAB. Question 1. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates option A, normal cellular metabolism, option B, hypoperfusion and anaerobic metabolism, option C, kidney failure, option D, liver failure. The correct answer is option B, hypoperfusion and anaerobic metabolism. Question 2. The emergency nurse is caring for a patient with suspected pericardial tamponade. Which triad of findings, Beck's triad, is most consistent with this diagnosis? Option A, fever, chest pain, friction rub. Option B, hypotension, muffled heart sounds, distended neck veins. Option C, hypertension, bounding pulses, headache. Option D, dyspnea, crackles, pink frothy sputum. The correct answer is option B, hypotension, muffled heart sounds, distended neck veins. Question 3. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects option A, cystitis, option B, pyelonephritis, option C, nephrolithiasis, option D, renal artery stenosis. The correct answer is option B, pyelonephritis. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. The most common cause of acute renal failure in hospitalized patients is option A, glomerulonephritis, option B, acute tubular necrosis, option C, renal calculi, option D, pyelonephritis. The correct answer is option B, acute tubular necrosis. Question 5. Meningitis is an inflammation of the option A, brain parenchyma, option B, meninges covering the brain and spinal cord, option C, peripheral nerves, option D, ventricles of the brain. The correct answer is option B, meninges covering the brain and spinal cord. Question 6. A patient presents with sudden onset worst headache of my life. The nurse's first priority is option A, administer pain medication, option B, perform a complete neurological assessment, option C, prepare for lumbar puncture, option D, obtain a non-contrast CT scan of the head. The correct answer is option D, obtain a non-contrast CT scan of the head. Question 7. Le-Fort fractures are classifications of fractures of the option A, mandible, option B, mid-face and maxilla, option C, orbit, option D, nasal bones. The correct answer is option B, mid-face and maxilla. Question 8. Hepatitis A is primarily transmitted via option A, blood and body fluids, option B, fecal-oral route, option C, sexual contact, option D, contaminated needles. The correct answer is option B, fecal-oral route. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, a neurological status, option B, a renal function and urine output, option C, skin integrity, option D, cardiac rhythm and rate. The correct answer is option B, renal function and urine output. Question 10. The best method to remove a prosthetic eye in an emergency is option A, using forceps to grasp the prosthetic, option B, applying suction with a bulb syringe, option C, using a suction cup designed for prosthesis removal, option D, sweeping a finger around the edge to break the suction. The correct answer is option C, using a suction cup designed for prosthesis removal. Question 11. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, tracheal deviation to the left, and hyperresonance to percussion on the right. The priority intervention is option A, obtain a stat chest X-ray, Option B, a needle decompression at the right second intercostal space. Option C, administer albuterol nebulizer. Option D, prepare for intubation. The correct answer is option B, needle decompression at the right second intercostal space. Question 12. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is: Option A, obtain a urine pregnancy test. Option B, administer pain medication. Option C, prepare for pelvic exam only. Option D, discharge with follow-up. The correct answer is option A, obtain a urine pregnancy test. Question 13. The initial fluid resuscitation bolus for a patient in septic shock, per surviving sepsis campaign guidelines, is: Option A, 250 ml of 0.9% normal saline. Option B, 500 ml of D5W. Option C, at least 30 ml/kg of isotonic crystalloid. Option D, packed red blood cells to achieve a hemoglobin of 10 g/dl. The correct answer is option C, at least 30 ml/kg of isotonic crystalloid. Question 14. Ovarian torsion presents with: Option A, bilateral lower quadrant pain. Option B, a sudden, severe unilateral lower abdominal pain with nausea. Option C, painless vaginal bleeding. Option D, a fever and purulent discharge. The correct answer is option B, sudden, severe unilateral lower abdominal pain with nausea. Question 15. Which finding on end-tidal CO2, EtCO2, monitoring indicates successful endotracheal intubation? Option A, EtCO2 of 0 mmHg. Option B, persistent EtCO2 waveform with each ventilation. Option C, PtCO2 of 50 mmHg. Option D, a flat line waveform. The correct answer is option B, persistent EtCO2 waveform with each ventilation. Question 16. Priapism is a urological emergency characterized by: Option A, painful, prolonged erection. Option B, inability to void. Option C, testicular torsion. Option D, a scrotal edema. The correct answer is option A, painful, prolonged erection. Question 17. To calculate cerebral perfusion pressure, CPP, the nurse needs to know: Option A, heart rate and blood pressure. Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Option C, respiratory rate and oxygen saturation. Option D, is central venous pressure and cardiac output. The correct answer is option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Question 18. A patient with a suspected spinal cord injury develops hypotension and bradycardia. The nurse suspects: Option A, hemorrhagic shock. Option B, neurogenic shock. Option C, cardiogenic shock. Option D, anaphylactic shock. The correct answer is option B, neurogenic shock. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. Sengstaken-Blakemore tube placement is used as a temporizing measure for bleeding from: Option A, peptic ulcer. Option B, esophageal varices. Option C, diverticulosis. Option D, aortoenteric fistula. The correct answer is option B, esophageal varices. Question 20. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A, confront the colleague directly. Option B, report the observation to the charge nurse or manager immediately. Option C, document the observation in the patient's chart. Option D, call the police. The correct answer is option B, report the observation to the charge nurse or manager immediately. Question 21. The most effective method to control severe bleeding from an extremity wound is: Option A, elevation. Option B, direct pressure. Option C, pressure point compression. Option D, ice application. The correct answer is option B, direct pressure. Question 22. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A, abdominal X-ray. Option B, abdominal ultrasound. Option C, CT scan of the abdomen. Option D, a complete blood count. The correct answer is option C, CT scan of the abdomen. Question 23. The emergency nurse suspects acute epiglottitis in a patient presenting with option A, inspiratory stridor, drooling, and tripod positioning. Option B, barking cough, low-grade fever, and hoarseness. Option C, productive cough, pleuritic chest pain, and fever. Option D, a wheezing, prolonged expiration, and accessory muscle use. The correct answer is option A, inspiratory stridor, drooling, and tripod positioning. Question 24. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to option A, insert a urinary catheter immediately. Option B, perform a retrograde urethrogram before catheter insertion. Option C, irrigate the bladder with normal saline. Option D, prepare for suprapubic catheter. The correct answer is option B, perform a retrograde urethrogram before catheter insertion. Question 25. Which of the following is a sentinel event that requires reporting to the Joint Commission? Option A, a patient fall that results in a minor abrasion. Option B, a medication error that causes no harm. Option C, a surgery on the wrong body part. Option D, an AMA discharge. The correct answer is option C, surgery on the wrong body part.